everyone, my name is Dr. Chinwe Onuegbu, a primary care physician and head clinical services at Paragon Clinics and Imaging, also a wellness doctor consulting for NEM Health, Nigeria. I'm here to take us on a teaching on the silent killer, hypertension. In today's world, with the COVID pandemic and the sit-at-home, work from home, a lot of people got more engaged in the sedentary lifestyle, having to sit at their desks for long hours, eating, taking their breakfast, lunch, dinner on their desk, and working for longer hours than necessary. Close of business usually was 4 p.m. and resumption 7:30 or 8 a.m. But these days, as early as 3 a.m., 4 a.m., people are already on their desk, responding to mails, and remain there up to 2 a.m. the next morning. I'm going to take us through what hypertension is, what is responsible for hypertension, the various symptoms of hypertension, what must I do as an individual, how can I get treated, and then the conclusion at the end of the day. The word there, silent killer, is not to scare us, but just to create the awareness why it is necessary to pay particular attention to our health. What is hypertension? As people would say, high BP, or some would say high blood pressure, is a condition characterized by the blood vessels having a persistently raised pressure. It is normal for the pressure to be raised at some point or the other, but then the key word there is persistently. Simply put, what we're saying is the force of the blood pushing against the artery wall is constantly high. And what's the effect on the heart? It makes the heart having to pump so much, work so much to pump blood. You're putting a lot of pressure, because as the pressure in the vessels keep coming, it's like double the work for it. Consider having a pipe you lay on the ground and it has a normal pressure of which either oil, fluid, fuel, whatever passing through it should go through, and then suddenly there's an increase. Also remember, the valves that have to control these things would not be able to take it. Even the pipe itself has a particular density and all it's made for, and has a pressure it should carry. But then over time, it might not be able to sustain this because it was not meant for that kind of pressure. And what do you expect would happen? If these pressures increase at some point, it will not be able to take it. There could be a rupture of the vessel, there could be the sludge of the valve controlling it, or the heart itself that has to receive all this might just decide one day to stop. And that's why it's called a silent killer. I just want to take us through blood pressure classification. Blood pressure is measured in milliliters of mercury, and in recent time, 140/90 milliliters of mercury and above was considered the definition. But then we discovered over time that by the time patients come with this particular blood pressures, complications have set in. So there's a new world order. It's still being debated, but most cardiologists have come up with 135/85 millimeters of mercury or higher in recent time has become the acceptable. So if your blood pressure is 135/85 and above, you are termed to be hypertensive. The normal blood pressure is considered at the level of 120/80 millimeters of mercury. Elevated blood pressure starts setting in when you have 120 to 129/80 to 89. And then this is the point where you need to start checking. You need to start doing things to put a check on your blood pressure, because you are at the stage of getting into what we term stage 1 hypertension, which is 130 to 139/80 to 89 millimeters of mercury. I guess some people are becoming scared because at some point in time you have gotten these blood pressures, but not to worry. That's why this teaching is there. There's still hope for you at the end of the tunnel. Stage 2 hypertension is 140/90 or higher than. So you see from the definition and the classes of hypertension, 121 over 81 is an elevated blood pressure, because what it has to be is between 120 over 80 and below. There's also another classification where you have either primary or considered essential or secondary. The primary hypertension, those who of no known cause. You had a check, one can really pinpoint what is responsible for the hypertension. Also, the age could also be a factor for these ones. And finally, unhealthy habits, the kind of meals we eat, alcohol, tobacco use, these all fall into the class of the causes of primary or essential hypertension. Then for secondary hypertension, this is hypertension that results from medical conditions such as a renal problem, an adrenal gland problem, thyroid problems, etc. Also, there are some medications which have also been implicated in hypertension. NSAIDs, anti-epileptics, birth control pills, and some illegal substance like cocaine and the rest. We're not saying that there are no cases of people who do not have these factors but still come down with this disease. But then, these are possible causes of a secondary hypertension. Then we also have the pregnancy-induced hypertension. This is hypertension that comes at the later part of pregnancy. The lady is stable all through, but somehow within the second trimester, following blood pressure checks, it's discovered that she is hypertensive. There's a tendency that upon delivery and out of the postpartum phase, these symptoms resolve, but there's also a possibility that they may never go down, and such a person is definitely now put on medications for control. What is responsible? What are the risk factors? Age. The older we get, the more the chances of coming down with hypertension. The black race, unfortunately, has been implicated for reasons, probably our lifestyle. It's also one of the contributing factors why the blacks are said to have hypertension more commonly. A family history. Hypertension is genetic. Do you have a father? Do you have a mother who is hypertensive? The chances that one or two siblings may also have that, and that calls for us being conscious of our health the more. Obesity, increasing weight, overweight. This tends to affect the renin-angiotensin-aldosterone pathway, which is responsible for blood pressure control. I wouldn't want to bore you with all that semantics, but then this is where obesity comes into play. Lack of exercise. We sit at a place, like as earlier started, the work from home syndrome. Remember, sitting in the office, there are times you will need to get up from your desk to go to the next person's desk. There are times you might need to go out for lunch. There are times you might need to get up from your desk to pick up one thing or the other, go to the dispenser at the other end of the office to get a glass of water. But then, with work from home, everything is at your bed. You keep your cups, your food, even the plates for the meals, for the breakfast, the lunch and dinner are all there. No need to get up. The internet is there, everything is there, and you're all there for the rest of the day. Sedentary, no activity whatsoever. The only time you probably get up is to have a shower and then still come back to bed. Lack of exercise is also a contributing factor. Tobacco use, smoking, all forms of smoking, the weeds, the sushis and all that. There's none that is considered healthy. They're all implicated in causes of hypertension. Too much salt. There are lots of people who, if they don't have to sprinkle an extra, yes, they keep the salts at the table, but it's not compulsory for you to use. You have to add a little extra for your meals. No. Remember, the cubes, the seasonings, they all have a bit of this. And having to add that, you're just putting a whole lot of salt in that one meal. Alcohol intake. And then finally, like I had earlier mentioned, the sedentary lifestyle. Symptoms of hypertension. Surprisingly, most people with high blood pressure, even with dangerously high levels, do not have any symptoms. Isn't that scary? That you might have something and nothing tells you. If you have a malaria, once in a while you will complain of a headache. You might have a body temperature. You will notice you're very tired in the morning. You're weak. But then for hypertension, sometimes, remember, your alarm can be there and it might never go off. The alarm might be set for the light when the light comes, and it might never come, only for you to come out to discover that the light is there. That is the same case with hypertension. Sometimes these symptoms, but then there is a small proportion of people who could have these symptoms: headaches, shortness of breath, and nose bleeding. But if you look at these symptoms, they are also peculiar with all other diseases. So they're not specific for hypertension. It's not a case where you say, if you find this, then this person is hypertensive. There are all other factors that could. Trauma to the nose could cause the nose to bleed. A respiratory problem could cause shortness of breath. Malaria and all other parasitic infections and all could also give you a headache. So you still see that there are no specific symptoms for hypertension. What must I do? This is where you have a responsibility on your path. Having a blood pressure check as a routine doctor visit is essential. You can walk into facilities from time to time to have your blood pressure checked. The same way we spend so much money on getting the best phones, the best gadgets, we can also get a blood pressure monitor at home. It takes some finger batteries at most, and there are those which you can connect directly to current. And always have a check. First thing in the morning, 2 or 3 times in a week, and chart. Have a chart of what your blood pressure looks like, so that at every point in time, you can comfortably say, this is my normal. And then, if you don't know the normal, you can't know what is abnormal. You can't know when it's increasing. And you see some patients will come and say, I have never had this kind of blood pressure before. And the next question is, when was the last time you checked your blood pressure? You will hear 2 years ago, 3 years ago. I believe in 2-3 years, a lot has happened, as long as you're in Nigeria, even in the world at large. So, is that a basis for comparison at this present stage? But if you had a BP monitor at home, you can just do that and have a check. So, and for you to say you are hypertensive, there must be 3 consecutive high readings taken at different times. And also remember, the values, they have their different implications. The upper value is termed the systolic, the lower value is termed the diastolic. For the systolic, it takes the blood pressure reading in the pressure in the arteries when the heart beats. While the lower one, which is the diastolic, takes the pressure in the arteries between the heartbeats. So every value is significant on its own and independent, and tells the clinician where your issues are and where to apply and what form of treatment or medication to use at this point in time. Are there other things you could do? You have a laboratory test, just in case it's a secondary type of hypertension, to look at your kidneys, to look at your adrenal glands, to look at your liver, to do a thyroid function test, to also check your cholesterol levels, because all these are implicated in hypertension. Are there other forms of tests? And ambulatory monitoring. Let's say you are in doubt. The blood pressure reading gotten at rest. You're not comfortable with it. A BP monitor is called an ambulatory BP monitoring machine. It's put on you to go through your day's activity for the 24 hours. It takes measures of your blood pressure at different intervals while you do your work. And then an average of each of them is looked at. And if at every point in time there is an elevation, it means you are hypertensive, because whether at rest, whether in engaging in one activity or the other, it tells us that there's an issue somewhere, and removes every reason to doubt, every reason for your doubts. Because at this point in time, it's not the environment of the hospital that is responsible. It's not who is taking it, because you're moving about with the machine and going about your normal activities. Also, an electrocardiogram, that's the ECG, that looks at the heart's electric activity. It tells us simply how fast or slow the heart is beating. With an ECG reading, one can say at what point or the other you have a problem with the heart. Remember, like I earlier said, all the blood coming in goes to the heart. It is the channel of distribution, just like the water board that is responsible for our water, sending it to the different homes. So that test itself looks at the activity of this organ as to tell us, is it beating at the rate it should? Is it too slow? At what point is the problem coming from? Also, an echocardiogram, a heart scan, simply put, also tells us shows us how the blood moves through the vessels and the valves. So if there's an issue with either the left side or the right side of the heart, the echo scan will pick it up. You see, there's so many things you could do and discover if you are in health or not. And all these services are available here in Nigeria. You don't need to go to any place. You don't need to travel around the world. Just the nearest hospital to you, it's there, available for our use. Sometimes we should try believing in ourselves and know that we have these things. Care is not about who gives it. The care is everywhere and can be received at all times. So also, how can I get treated? That's another jawbreaker. Hypertension has no cure. I believe in miracles, and I know some of us watching will say it's not my portion. My father did not have it. My mother did not have it. But then, surprisingly, it has come at your doorstep. But then where your faith comes in is dealing with it and telling it, yes, you have come, but I have the medicine for you. So with hypertension, there is no cure till date. At a time T, we have not discovered a cure for hypertension, but it can be managed. And this line of management, when adopted, men and brethren, it's for life. It's not a drink and stop. It's not a start and stop. It's a continuous process. The pressure is there already. The medications or lifestyle modifications come in to control it. Always know that if you stop, the process starts off again. Have you wondered why even when the government gives their rules and regulations, the regulatory bodies are still formed? Why? Because at some point in time, somebody needs to be put in check. So that's why these medications are there for life. Lifestyle modifications are part of the management model. What does it help to do? To control and manage your high blood pressure. What is involved in lifestyle modification? Your diet. Taking a dietary approach to stop hypertension, which is simply put the DASH diet we all hear. What is it all about? Eating more vegetables, whole grain, and fruits. Managing your diet properly. Regular physical activity. Exercises, not once in a while. On a Saturday, you jog the whole of Port Harcourt. You join the crew. The rest of Monday to Friday, you're sitting in one place, not standing, not doing anything and all. No, it has to be regular. Adopt something that works for you. A 30 minutes jog in your room, 15 minutes aerobic, but how regular is it? Taking walks at home, how the regularity of this is what is important. It's not a one-off thing. It's not a once-in-a-while thing. It should be a continuous process. Healthy weight, maintaining a healthy weight. And if you're already big, making attempts to losing the weight. Yes, the big size is good, but then a big healthy size is important. Okay, reducing your volume of alcohol. It's said that men are supposed to take 1 or 2 bottles of alcohol in a day, and for the woman, just a bottle. But then we see a lot of people who finish a whole crate at a sitting and then term themselves the big boys or the big girls, the high consumers. Sometimes we mix all manner of things. We do the beers, we do the spirits, we do the vodka, we do all that, and then bring in the tiny bottles we say are for the odogus and all. to improve this and improve that. All these going to hit one particular organ, the liver, which has to keep breaking and breaking these things, and then sends it to the kidneys, which would have a hard time excreting it, thereby gradually pushing us into the secondary category of hypertension. We need to check our alcohol intake. You need to stop smoking. Put a check on how many sticks are you consuming and start tapering down till you finally eliminate it. 6 to 8 hours of sleep a day, it's very important. Yes, some people would argue the great men, they didn't sleep for, they said they slept for only 3 hours in a day. They slept for. Then you and I wouldn't know the effect on their health now, because the body needs to rest. Even God, He created the world in 6 days, and on the 7th day, the scriptures still we have all read until tomorrow says, and God rested. If the omnipotent, omniscient one and omniscient one could take a rest, my dear brother, 6 to 8 hours sleep is necessary. It might not be an everyday thing because of probably your workload, but then a reasonable hour of sleep to shut down and rest so that the brain has enough time to reboot and start off again. There are times when your phone, having worked for long hours, forces you to do a restart on it. It's simply saying, guys, I need to take a rest. Just allow me. Reboot me again, and then I'll come back to life. Also, work on managing your anger and stress. It's not every question you need to answer. It's not every one you need to respond to. Even when you're man enough to fight, do the fight. Sometimes walk away. Try to manage it. The stress will come. You take a cab, you get into your car, you drive off, you're going to meet an auto rickshaw who is not even looking at the driving signs and all that, who doesn't know what a traffic indicator is, who doesn't know where to turn around and where not to turn around. It will cause you to want to shout. It will cause you to want to raise your voice. You get into the office, that colleague who would not do things right. Learn to manage your anger and stress, because at the end of the day, it's going to take a toll on your health. Also, medications come in as a line of treatment. I'm not going to be looking at the different drugs you should take, because one, the drugs you take are dependent on different factors. One, your overall health. This the physician needs to look at. There are certain questions you will be asked. There are certain things, tests that will be done for you, and this will determine what class of medications you should be put on. Some people will say, I collected my friend's drug to take. I just asked my neighbor beside me, and he shared an amlodipine with me. He was given amlodipine for a reason. You need to go to the hospital and have a check, and the doctor there will determine what line of management to start with you. His could have been a monotherapy. Yours could be a triple therapy, where three drugs would have to be added. So, depending on your overall health. Also, the level of the blood pressure at the check. An extremely high blood pressure might require an intravenous antihypertensive. And then going to take a tablet might do little or no work for you. So the level of the pressure is also considered when putting you on medications. And finally, the presence or absence of a comorbidity. What are these comorbidities? A renal issue, diabetes, cholesterol, high cholesterol, a thyroid gland issue. Have you had a stroke in the past? These are things that are considered. Obesity, they are all put into consideration. So I wouldn't go discussing what drugs to take, because I expect you to go to the hospital, have a check, and then have a discussion with your doctor. Your doctor would take a decision based on these factors: your overall health, the level of the pressure, and if you have any comorbidities whatsoever. So on that note, we look at the complications. The high pressure on the arterial wall can damage the blood vessels and blood organs. Like I had said earlier, If the pressure continues, these pipes or arteries, they have a capacity they can take. They have the strength they are built for. They have the pressure they were created for. So when it gets beyond that, it could either cause a bulge or it could rupture. It could also cause the valves to malfunction. It could also affect the heart itself. So the higher the blood pressure, the longer it takes to get controlled. This is already a high blood pressure. It's taking a long time to be controlled because of probably maybe a kidney issue, a thyroid issue, etc. Also, the greater the damage anticipated. You see why it is good to have a check, to find out what is actually wrong and seek help immediately. What are these complications? A heart attack or stroke. In recent time, we've seen those who just suddenly collapsed. Not because they were thinking about those they were owing. Some of them didn't have people chasing them for loans and all that. They were all loving people, smiling, probably had a party or two the day before, had a chat with family, and they suddenly slumped. The heart just decided to stop. The problem had been ongoing, but nobody paid attention to it. You could just wake up one morning and say, I can't feel my left side or my right side. That's a stroke in evolution. You suddenly look at the mirror and notice your mouth has moved to the right or to the left. You say, my people have come, my village people. My dear, before you begin to attack the village people, ask yourself the question, what is wrong? What is my blood pressure? What have I not done properly? Are you already on medications? Have you been taking them? Have you been religious with the lifestyle modifications you've been given? That you're put on medications doesn't exclude you watching your weight and watching your diet. Also, a heart failure. The heart can decide to stop, decide to fail, not pumping blood as usual, such that some organs are not receiving enough supply as they ought to. Just like with the water board that is usually not functioning anymore, and people now have to drill boreholes in their houses. Growing up as a child, we had the taps running, but now, the same way the water board couldn't supply anymore, the same way the heart can decide to fail and stop in its function. Kidney problems, eye problems, the vessels, a change with memory or understanding, issues with body metabolism. These are a few of the complications. And then an aneurysm. This is where there's an increased blood pressure causing the blood vessels to be weakened, and they can bulge and also rupture. And when there's a bleed up there, there's an internal hemorrhage. The risk is higher. The chances of dying are higher. The prognosis is usually very poor. And it's bad for something that can be prevented. Hypertension is a health body. Hypertension, it's a global issue. Hypertension is something that does not recognize age, status, religion, tribe, or ethnicity. It affects everyone. And it has been described as a silent killer. Silent because there are no known signs and symptoms for hypertension. If you don't get checked, you don't know. If you don't see a doctor, you can't tell. So, these triggers, these alarms might not go off. These notifications, they may never come. The first instance might be that sudden collapse at the office, and then wonder if there's nobody around to have to rush you to the hospital. Supposing there is nobody there to offer the necessary first aid. Let me try to put a smile so that it doesn't seem as if I'm reading a death sentence for someone. But then, if we do not manage it, we stand the risk of developing serious illnesses. The good news is it can be managed. The good news is modern science has made available treatment options that are easy to comply with. Medications have been made in such a way to reduce the pill burden on patients, where 3-4 drugs are combined into one pill to give the same effect. But my advice today to you is, once that diagnosis has been made, once that regimen has been started, please stick to it. It's not just about sitting down and taking these medications. You need a follow-up visit with your doctor, because these doses, these drugs are often adjusted. Also, investigations are done from time to time to look at these organs to also put a check on them. Also, your lifestyle modifications are important. Remember, most people would argue, I started taking the medications and my blood pressure dropped. No, that's only one problem solved. The target of the drugs also is to preserve those organs that get affected by hypertension, and finally also to prevent you from having the complications that come with the disease. So even if you have your blood pressures coming down, it's not a reason to stop your medication. Discuss with your clinician. Doses can be adjusted with time, but then this treatment modality is for life. And also, keep a positive mindset, knowing that it's going to get better. You're going to be fine. All you need to do, the same way you need to eat food to stay alive, the same way you need to do all that is necessary to remain here on earth, the same way you need to pay particular attention on your health. Your health is your responsibility. And with these days, medical care is not as expensive as we think. The health insurances have made it available that with a certain premium you pay, you can walk into any facility and get care even if you do not have cash in your pocket. NEM Health is here for you. Get connected with them. They have different plans for different cadres, for different people. Family, individual, companies. Get in tune with them. With that, you could walk into any facility registered under them and have the necessary care done. You can walk in and just have a check. Sometimes it's not just to see a doctor. Sometimes it's just to walk in and have your blood pressure checked. So try NEM Health today, and they have beautiful packages for you. They are world class and they're ready to serve you. It's been nice talking with you. It's been nice having a good time with you. It's been nice teaching you on hypertension. It's still a silent killer, and we wouldn't want it to take more lives as it has done in the past. Your health is your responsibility. Thank you.